The medical information included in this podcast is provided as an educational resource only. Please consult your healthcare provider before making any healthcare decisions.
If you feel lousy, you should still do the things that you would do if you feel good. Because it is better at the end of the day to have gotten things done, and you're going to feel that anyway.
Are you waking up exhausted? Are you up in the middle of the night and can't fall back asleep? Waking up too early? Or does it take a few hours to fall asleep at night? It turns out you're not alone. Of course, we all have nights where we toss and turn, but what's interesting is more and more Fabry patients are reporting that they too are having trouble sleeping. Sleep is critical for cognition, mood, immunity, neuroplasticity, pain, and so much more. It's one of the fundamental pillars for better health. Our guest today is someone who recognizes the impact that this has on a person's life. And he also shares the same perspective that this topic deserves so much more attention, so we can better understand the relationship between Fabry and sleep. Dr. Hopkin is not only a distinguished expert in Fabry disease, but he is someone who embodies patient-centric care. He is an associate professor of clinical medical genetics at the Cincinnati Children's Medical Center. And Dr. Hopkin, I would like to take a moment to just say thank you, because you always make time to listen, answer any questions, and share your expertise. And you are helping patients live a better life. So welcome to the podcast, Dr. Hopkin.
Well, thank you. I am very happy to be here. And thanks for the kind words. I hope that this podcast will be of interest and helpful to a lot of people.
I think it will. And I know there's a lot that we are still learning about sleep, but why don't we start with what we do know about the relationship between Fabry and sleep?
So people have been reporting sleep problems with Fabry disease, I think, since the first descriptions, but we didn't really know much about it. Over the last several years, there have been some studies done, mostly just looking at how many people with Fabry disease have severe daytime sleepiness, and how is the quality of their sleep at night. And the studies that have been done to date have all showed that there is increased daytime sleepiness and increased fatigue, and those are a little bit different in people with Fabry disease compared to the general population. They have also showed that there is that fatigue, which is different than not being able to stay awake, but just feeling like you have no energy to get up and do something, is increased. So the sleep problem, we need more data, but in the studies that we have, it's estimating around 60 to 70% of people with Fabry disease have some increased daytime sleepiness. That's compared to 10% in the general population.
That is significant. And what do you feel the drivers are for daytime sleepiness and poor sleep quality, fatigue?
The first thoughts on the drivers were that it's probably related to the stage and severity of the Fabry disease. And so it's been looked at, and it turns out that this doesn't correlate with the stage or severity of heart disease or kidney disease or stroke like symptoms, that it seems to be independent of those, and it actually starts earlier than those things become a major focus for people. Starting as early as teen years, it hasn't been looked at in young children, but so that's another place to learn. But we think that it is a neurologic manifestation of some kind. It correlates to some extent with depression and anxiety, but is also partially independent of that.
Okay.
That just adds to the idea that it's central nervous system origin.
So is there a sleep cycle that seems to be more interrupted and disturbed?
That is a good question, and we don't have enough data to really answer that question. There have been a couple of studies looking at sleep quality.
Okay.
And one of the things that they found, they did a couple of things that were really interesting. One was asked people, how often do you take naps? And how long are your naps? So people with Fabry disease take naps more frequently. But the big difference is general population, typical nap is 15 to 30 minutes. And then people wake up and they're good to go and energetic. Fabry disease, it's 90 minutes to 2 hours, and they wake up and are still tired after that much of a nap. Then they looked at nighttime sleep. So if people go to bed and they sleep for a certain amount of hours, then they wake up, how do they feel when they're done sleeping? And people with Fabry disease tend to have much poorer quality sleep. So even if they're getting the same amount of sleep, they don't get the same amount of recovery from the rest that they've had.
So you did a patient survey that you conducted, and I believe was that last year that you did that?
Yeah, that was about a year ago.
Okay. Could you share some of the insights and key findings from that?
So we wanted to know, we had read the articles on sleep. We have patients that have reported sleep, and we're like, well, let's do a formal study. We contacted a sleep research group here and had them help us with it. And we started off with just looking at, are we going to find the same levels of sleep, of increased sleepiness and of fatigue? Our number for significant daytime sleepiness was a little bit lower than the previous studies. We got about 50%. That's still way more than the general population. But our fatigue, which we plugged in as a separate issue, came out about 80%. And that's a huge burden because It's hard to maintain a job. It's hard to take care of your house or your kids if you're too tired to move. And I've had patients tell me, well, when I need to do the laundry, I go get the laundry and then I have to take a break. And then when I can get up again, then I put it into the washing machine and then I have to take a break. And then I do all the settings and I get the laundry done. And then the next step, and it ends up taking them a half a day or sometimes a whole day just to do the laundry for a small family. That is not normal. I think that's more extreme than most people potentially, but that's the kind of difficulty that we're looking at. And obviously, if you're holding a job and you're having that kind of difficulty, that's going to be a bad thing.
For sure. And it's probably so frustrating because you're capable of doing more and you want to do more, but when your body just feels like it's holding you back, that is frustrating, but it also obviously really impacts your quality of life, your everyday living, right?
Yeah, and it's not like the people reporting that fatigue, they don't have severe depression, so they just don't want to get up.
No.
It's they want to get up and they feel physically like they can't. They don't have the energy to get moving, even though they want to do the things or need to do the things that are not getting done.
Right.
And that's a big challenge. It is complicated if you also have trouble staying awake. So the daytime sleepiness is a related but separate issue. And I think both of those, we need to have a better understanding, and then we need to figure out what can we do about it.
Yeah, for sure. I think That's the big thing. It's like, now we're hearing more and more patients are having this, and we want those to-dos. We want those action steps. I remember seeing that sleep apnea was something that was being more talked about with Fabry patients.
Sleep apnea has been studied, and we thought that sleep apnea was going to be a big thing.
Okay.
In this, but it turns out that there's only a little bit of difference between the level of sleep apnea in the general population and the level of sleep apnea in people with Fabry disease. So it is something that should be looked at if you're having poor quality sleep, but it's not the key driver of this problem for Fabry disease. It's a contributor, but a relatively smaller contributor.
And things like bradycardia, pain, other manifestations of Fabry. I mean, those ones make sense. If you're laying there and you're in pain and you're having trouble sleeping, there's something we can do about that, right?
Right.
Hopefully there's something that they haven't yet tried that can help with that. Is there other manifestations of Fabry that may be keeping patients up at night?
So the bradycardia is another one that's important. That hasn't been studied.
Okay.
But in our population, we have had several patients that had bradycardia, and eventually a decision was made to try a pacemaker, and all of them have had greatly improved energy.
Oh, wow.
So that is clearly a contributor, at least in the people who have bradycardia, and you can have the bradycardia before you have severe cardiac hypertrophy or other heart issues. So that's one thing. The brain in Fabry disease tends to over-respond to some kinds of stimuli.
Okay.
This is relatively new information, so I am not going to have very many details, but it looks like for the same stimulation, you get more nerves firing. And that kind of keeps you cycling through the same problem. So that is a reason that people might get upset or angry more easily, but it also is something that keeps you from calming down, because your brain needs to, before you fall asleep, needs to settle down and stop focusing on external issues. And if your system for filtering things out isn't working, then you're not going to be able to block those thoughts that you're like, well, that can wait until tomorrow. I'm just not going to worry about that. And your brain's supposed to do that kind of thing automatically. Hasn't been well enough studied to know for sure that that's a driver, but I think that it might be.
That's interesting. And I think it's that, plus it's layered on with then having probably more thoughts to do about your health. If you're a parent and you have children with Fabry, and it's kind of like that, those layers that are happening. And then if you're having trouble turning off those thoughts or more stimulus, then that's just making it even harder, which makes me wonder, I guess, if, the practice of meditation or practice of more finding ways to really, and outlets to really calm your mind, especially before sleep, because we know that, we are maybe more prone to having some sleep disturbances, doing whatever you can do to minimize that. Even practicing really good sleep hygiene, right? Like limiting screen time.
Yeah. Oh, for sure. That's going to be important. I think meditation is a good option for a lot of people. Something else that tends to be helpful for this is not right before bed, but daily exercise to the point that you can tolerate it. We're not asking anybody to push it so that they trigger a pain crisis.
Right.
Anything like that. But if you get regular exercise, get yourself into reasonably good physical condition, that tends to help with sleep quality. Again, not studied specifically for Fabry disease, but that's sort of a general population thing that does tend to be a significant help.
Okay, so exercise, maybe meditation, limiting screen time. I would assume diet.
Especially the last hour before you want to go to bed. All the stimuli that you have, kind of stop them unless it's something that helps you to focus. So like some soft music or a background noise that helps you to calm down is probably okay. Anything that catches and holds your attention, probably not something that you want.
You see a lot of patients in your clinic, and you do a good job. I think I really like your compassionate approach to this topic, because I think fatigue is really hard to, it's not so hard to talk about, but it is hard to be in a place where you're, recognizing that it's like, oof, this is hard to keep up, or this, I am having trouble getting to work and staying focused. And I am, all of these things are hard to kind of admit to yourself when you're going through that. For the patients listening and they're feeling this, what would you tell them? What do you want them to know?
So I think it's important to know that this is not laziness. Yeah. It's not depression. It's not any of the things that people probably accuse you of. It's a manifestation, appears to be a manifestation of Fabry disease, with some of that being just the fact that there's a chronic disease involved. But that said, there are things that have to be done. And I want them to know they can do those things. And one of the other things, I talked to a psychiatrist and said, what should I tell people? And she said, tell them that if you feel lousy, you should still do the things that you would do if you feel good. Because it is better at the end of the day to have gotten things done, and you're going to feel that anyway.
True.
When I first heard that, I thought, people are going to be offended by this. This is not good.
Right.
But as I've talked to people about it, they're like, okay, and they'll try it, and they get a little bit more done.
Right.
And you sort of put that into the win category. And you make life a game. And am I winning more often than I'm losing? And you make everything you do that gets done on a day is points in your favor. Embrace that concept. And then we don't have any studies looking at it, but we're starting to look at whether some of the approaches that we would use for things like narcolepsy might be useful for this.
Okay.
So we don't have a lot of data, just some anecdotal cases, but there are a couple of medications that have been used to treat narcolepsy and lack of focus or other things that are comparable, and see if they will move forward. And so, I had a patient who came in and said, my life is just terrible. I can't go on like this. I'm just getting ready to quit. This was somebody with pretty severe kidney disease, pretty severe heart disease. I'm like, what do you want? We talked about it, came up with a possible plan, but it was a medicine that can have impacts on the heart. And I'm like, yeah, we can't do this. But we sent him to the cardiologist, to a neurologist, to his primary care physician, and all of them, in the end, based on what he was telling us, we felt like we had to do something. He knew what the risks were. We'll do it. We looked at an ECG, made sure we weren't changing his heart rhythm or anything. But he got some energy back. That was, I think, about 5 years ago now. He's still doing better.
Oh, wow.
It has made a big difference in his life, and he's been able to start doing some of the things that motivated him when he was younger. And I think that warrants a more serious look on a larger scale. And it's something worth talking about with your providers.
When should patients consider discussing their sleep issues with their Fabry team, and how do they initiate this conversation effectively if they're to make it really well known that this is an issue that warrants some attention?
So you don't want to just walk in and say, I feel tired sometimes, because everybody feels tired sometimes. And so they're going to blow you off and say, that's just normal. You don't want to probably tie this, unless it really is tied to your pain, you don't want to tie it to your pain. You want to have it as a separate conversation. And I think it would be helpful if you have some specific examples.
Okay.
Like I had somebody who told me that she will cook dinner, but she doesn't eat with her family because after she cooks dinner, she has to take a nap. And then she gets up and eats later. And then she needs another nap after she does the dishes.
Oof.
And to me, that was pretty compelling. This is somebody who's doing what has to be done, but she's cut off. And it's like, wow. Okay, that I can see as a problem. If you've got a work problem related to this and you're doing the best you can, but you're getting negative feedback from your boss, or you're getting teased by your coworkers, that's a thing to mention, and say, I want to do something about this, and then work on it from there. I think that's how I would approach it, because I think you'll get more buy-in, more listening, if you can frame it in a way that clearly demonstrates what it's doing to your daily life and to your ability to function, and you're approaching it in a positive, motivated, I want to do better.
Okay, that's great. That's super helpful. I remember seeing a paper that was talking a little bit about Fabry and circadian rhythms. Are you familiar with the paper? And was there any sort of kind of breakthrough with that, or any findings?
Yeah. So that's more evidence that there's something neurologic going on with it. It does. So the circadian rhythm is the wake-sleep cycle, and then the different steps in the sleep cycle. And we're supposed to have that, and it's partly controlled by the number of hours of daylight that we have. And when the light starts to go down, your brain releases chemicals that tell it's not put you to sleep, but say it's time to get ready to go to sleep, and you start to calm down. And that cycle isn't very efficient. It's not well controlled in Fabry disease. And I think that is, the autonomic nervous system controls heart rates, blood pressure, sweating, other things like that. And it makes sense to me that if those things, and we know all of those things are abnormal in Fabry disease, if those are abnormal, the circadian rhythm is abnormal, there's probably a connection here, that the autonomic nervous system that sort of keeps your daily cycles lined up isn't as controlled as we would like it to be. Now, what do we do with that? We're still working on that.
Okay, so would getting out in the sun first thing in the morning be then probably a good idea to get that early morning sunlight?
I think it would. Yeah, getting the sun and being outdoors part of the day is, generally speaking, good for your health. It will also help your vitamin D levels, and lots of people with Fabry disease have low vitamin D.
Right.
So there's going to be those benefits for sure, and I think it may very well help with the sleep cycle. Also, not napping excessively. So if there's a time of day when you just really need a nap, having it be, the kind of a nap, and you might have to set an alarm to wake up, the kind of a nap that somebody in the general population would take. So 15 to 30 minutes.
Okay.
And then get up when you get up, you're probably still going to feel sleepy. So do something that will really engage your mind, or something that's physical, because those are going to be better ways to wake up than just trying to force yourself to focus.
Yeah, like trying to push through and okay.
Right.
So that's great.
And having that planned before you get up. So knowing what you're going to do. And then getting up and starting to do that is going to be the most efficient way. And then the sleep hygiene piece is really important. Having a ritual that you use that gets you to bed, that sends a signal to your brain of it's time to calm down now. We're coming to the end of the day.
So as you're talking, I'm learning, and I'm also hearing there's some ways that we can take action as patients. So we've identified that Fabry does impact sleep quality and daytime sleepiness and fatigue. So I think for the patients listening, I would like to ask them to ask themselves right now, how have I been sleeping? Do a bit of a self-evaluation, because sometimes we get lost in all the other things and symptoms. So ask yourself, how am I sleeping? And if your answer is that you're not sleeping well, communicate this with your Fabry team, because they care, and it's important to identify if there is something that can help. And it's also important to on a greater picture, to let your Fabry team know, because, globally, when we're speaking about this and we're talking about this, it's important to all bring this forward when we're having symptoms. Sometimes I've been guilty of this where, I have kind of my priority things I need to talk about, but I don't know if I have time to get to the other things. And that sleep will probably go to the end of the list. But it's just as important. So bring that up. And, ask for a sleep study, perhaps. So you learn what's going on specifically in your own body. And then, as Dr. Hopkin was saying, exercise, practice great sleep hygiene, get out in that sunlight, practice a healthy diet, all the things that we can control. We can do those things because this matters for our overall health. Dr. Hopkin, is there anything else you'd like to share with our listeners as a fun
I just want to re-emphasize the importance of paying attention to where this interferes with your daily life, because that's going to change the options for intervention that might be tried. It's going to help the other people on your team that you're working with. It's also going to help you if you know what's coming and you're like, how can I be ready for that? And what are the things that help me to be a little bit more energetic or that interfere with it? And so you can line things up so if something's really important, you improve your chance of feeling good that day. But then also reporting those things, where it interferes, where the biggest struggles are, to your healthcare team, and that will help them be able to come up with potential solutions more effectively than just, I'm always tired, which even if that's true, it's really hard to target always.
Right.
So we want to say, where are the priority things and what can we do to help optimize those things? And then hopefully we find out at some point what's driving this, and then maybe we can target the actual physiology and have better options for treatment. But for right now, it's going to be more targeting the symptoms. But there are ways to do that. We just need to pay attention to it and acknowledge that this is really a part of Fabry disease. And it's not just somebody being discouraged or having a chronic illness. It's more complex than that.
And I think there is some hope as I'm listening, because I think there's more eyes on this topic. I certainly know that you've been, researching this more, and you're really understanding it a lot more. And I know you and I have talked about some potential projects we can work on together to bring in more data and research. And so I do feel like there's a bit of a hopeful piece there.
Yeah, I think so too. I think, well, and the other thing that I think is really hopeful is we're starting to have some serious looks at treatment for Fabry disease that actually gets into the nervous system. And I think that will also potentially be helpful.
Yeah, I think so too. Is there any final tip or closing thoughts you have?
No, I would like to thank you for this, though. This is a really important, interesting topic, and I love being able to take a deep dive into it and talk about it. So thank you for having me.
Well, thank you for making the time for us. One of the goals of this podcast is to just help patients better understand their disease and the steps they can take to live a better life. So thank you for sharing your expertise with us. Thank you for taking the time and caring so much about this topic, because it means a lot to all Fabry patients, and I can tell you that for sure. It's always a pleasure speaking with you. Thank you.
Thank you for having me.
You can follow the Canadian Fabry Association on Instagram, Facebook, LinkedIn, and visit us on our website, fabrycanada.com. And of course, if you haven't yet, subscribe to this podcast. We'll see you next time. Keep listening, keep learning, and be rare, be you.